Can a guy wear a condom during oral sex? Oral sex can be a natural and enjoyable part of sex between partners if both of you enjoy it and consent to it. You can give or receive oral sex as part of other sexual activity, like vaginal or anal intercourse, or on its own. But oral sex without a condom does come with risks. Oral sex may not pose pregnancy risks, but it's far from a safe sex. You can still pass sexually transmitted infections, STIs, between you and your partner. Many experts say oral sex is not safe sex. It may be a safer sex than genital sex without a condom, in that you won't get pregnant from oral sex alone, but oral sex without a condom still carries the significant risk of catching or passing on sexually transmitted infections, STIs. Because oral sex usually involves sucking or licking your partner's genitals or anus, you're likely to come into contact with genital fluids or feces, and this puts you at risk of many STIs. Generally, you're more at risk of catching an STI from oral sex if you give rather than receive oral sex, because you're more likely to be exposed to genital fluids, you have cuts, sores or ulcers in your mouth at the time, you don't use protection. Another risk of oral sex is strain on your relationship, particularly if one of you doesn't enjoy it or has concerns about it. One partner may have anxiety about their oral sexual performance or what their partner will think of them during oral sex. Or oral sex may make one partner feel under the other partner's control. These are all important issues to resolve before introducing oral sex into your relationship. STIs from oral sex. A range of sexually transmitted infections, STIs, can be associated with oral sex. The following are some of the most common ones. Human papillomavirus, HPV, or genital warts. HPV is known as the virus that can cause cervical cancer in women. But HPV can lead to a range of other cancers too, such as throat or oral cancer or cancers of other parts of the genitals, and other serious diseases. HPV is a common virus that can affect both males and females. It's passed on through either genital or oral sex. HPV affects both heterosexual and same-sex partners. Some strains of HPV result in genital warts, soft growths that occur on the genitals, although it's rare for genital warts to be passed to the mouth and lips through oral sex. Genital warts are very common, but can't be cured. They may be treated with medications or surgery. Sometimes HPV shows no signs or symptoms at all. Your risk of HPV is higher the more partners you have. Contracting HPV doesn't guarantee cancer, but US studies have shown more than 50% of cases of oral cancer can be linked back to HPV. For instance, men are more at risk than women. If you suspect you have HPV or genital warts, talk to your doctor. Herpes. Herpes is a common STI that has two types: oral herpes, blisters and cold sores around your mouth or nose, and genital herpes, pain, itching and small sores on the genitals that turn into ulcers and scabs. You can catch either type of herpes from oral sex without a condom and vaginal or anal sex without a condom too. If your partner has cold sores around their mouth, oral herpes, they can pass these on to your genitals during oral sex if you have not had cold sores in the past. If your partner has herpes blisters around their genitals, they can pass these on to your mouth if you give them oral sex. Sometimes you can have herpes but not have any symptoms. You can still pass on the disease through skin-to-skin contact. Gonorrhea, chlamydia, hepatitis B, hepatitis C. All of these STIs are caused by viruses or bacteria that can be passed on in the same way, through contact with infected bodily fluids, such as semen, pre-ejaculatory fluid, blood, or vaginal secretions. So oral sex puts you at risk for these diseases. You may be infected with one of these STIs if infected fluids come in contact with any sores, cuts, or ulcers you may have. The fluids can also get into inflamed cells on the lips, mouth, genitals or anus, the membrane of your eye, or the cells of your throat. This contact can allow the fluids to get into your bloodstream and make you sick. HIV. Experts say the risk of contracting HIV from an HIV-positive person during oral sex is extremely low, but it's difficult to know exactly because people often participate in vaginal or anal sex at the same time as oral sex. The risk of contracting HIV increases if you have sores in your mouth or on your vagina or penis, bleeding gums, mouth contact with menstrual blood, or other STIs. Syphilis. Syphilis is a very serious condition if left untreated, but can be cured with the right treatment. Symptoms come in 3 stages: a single sore, often painless, then a rash or sores, or both, then organ damage and possible death in the late stages if left untreated. The late stage of syphilis may not develop for 10 to 30 years from when you were infected. You can catch syphilis by coming into direct contact with a syphilis sore during vaginal, anal, or oral sex. Sores may be on your partner's penis, vagina or anus, in the rectum, or on their lips and in their mouth. How to reduce the risks of oral sex. Like any sex, the best ways to reduce the risks of oral sex are to abstain, not have oral sex, or to use protection. Avoid oral sex if your partner has an STI, has sores, cuts, ulcers, blisters, warts or rashes around their genitals, anus or mouth, has unhealed or inflamed piercings in their mouth or genitals, has a throat infection, is a woman and has her period. Avoid getting semen or vaginal fluid in your eyes. For oral sex on a man, use a condom during oral sex. For oral sex on a woman, or when performing analingus on a man or a woman, use a dam. A dam is a small thin latex or plastic square that acts as a barrier between the vagina or anus and the mouth. It may prevent the spread of STIs. STI testing. See your doctor about testing if you become sexually active, change partners, or start a new relationship. Also see your doctor if you think you have any signs and symptoms of an STI. Your partner should be tested if you decide to not use condoms. Oral sex and young people. Many young people do not consider oral sex as sex, so they may take emotional or physical risks.